I got a call from my friend. She said my dad came from office sitting on a chair and suddenly he falls down. She called me and started crying and told me everything and said I call the ambulance but maybe it'll take some time. Before I tell you the rest of the story, I want to tell you that I am a doctor by profession. When she was telling me about the history that what had happened, I asked her to check the breathing and pulse. She said no breathing and no pulsation. She called me after 20 minutes when his father suddenly collapsed and fell down on the ground. I have an idea that this is probably the case of cardiac arrest and the prognosis is not going to be good because it's about 20 minutes when she called me. It's obvious that they don't have any idea that what to do in such case of an emergency. They were waiting for an ambulance to come. I have decided to make a video to let people know that what to do in such situations. In case if she knows that how to give CPR, maybe she would be able to save his life. I believe that CPR should be taught to everyone in schools and colleges because the data of the cardiac arrest is increasing every day. Tell you what cardiac arrest is. In this, there is a sudden unexpected loss of heart function, breathing, and consciousness. In cardiac arrest, the heart abruptly stops beating. It can result in person's death, but it can be prevented if you take certain preventive measures. And of course, let me tell you one thing, never compare a heart attack with a cardiac arrest because they are different. CPR is used in a condition when there is a cardiac arrest. In case of cardiac arrest, the heart stops function and the blood will not circulate. This leads to cessation of breathing and loss of consciousness. When a person stops breathing, then no oxygen will be in the bloodstream. It ultimately leads to vital organ damage and patient will die within few minutes if not get the proper aid on time. To prevent this condition, we can give cardiopulmonary resuscitation called CPR. CPR can save the life in such conditions if it is given correctly. Today I'm going to tell you the few steps about CPR. Before giving CPR, make sure there should not be any danger to the rescuer and the victim, that is patient. Ask the patient for the response, "Hey, are you okay?" If he is not responding, then check his pulse. If there is no pulsation, then check carotid pulsation for not more than 10 seconds. And when you found no breathing, no pulsation, then start CPR immediately. One palm of one hand in the center of the chest of the patient and it should be between the breastbone and the backbone, and place the other palm of the another hand on the top of the first palm and interlock the fingers. Give 30 chest compressions and each compression should be 1.5 to 2 inches deep, followed by the 2 rescue breaths. Close the nostril and open the mouth with the help of chin to give 2 rescue breaths after each 30 compressions. There should not be less than 100 compressions per minute. Continue the CPR until the patient revives or until the ambulance arrives. Please share this video to your loved ones so that they can help others to rescue in such situations.